Hello, I'm Katie. I'm the educator here at Medela and I'm a midwife and lactation consultant. So what I want to talk to you today about is just when the milk comes in and your breasts start to fill. Now for most women this is a very normal process and you might wake up in the middle of the night, maybe between 24 and 80 hours after birth. The average is about 60 hours after you give birth that your milk will actually start to come in. And so you might wake up and suddenly go, goodness me, my breasts feel twice the size, they're quite warm, they're heavy, and they're probably a little uncomfortable. But other than that, baby's still feeding fine, and what you'll find is after about maybe 2 days, the breasts start to soften down a little bit. But for some mums, they actually become engorged. So this is when the breast actually gets incredibly full, and almost the breast tissue feels like rock solid. And again, this can happen anywhere between that sort of 24 to 80 hour period for most women. When women become quite engorged, what can happen is it actually, as the breast enlarges, it tends to flatten or even invert the nipple a little bit. And this can make it much trickier to actually get baby on to attach. So there's a couple of tips that can help if you are engorged. Now, if you're feeling that you are engorged at home, even with these tips, it's really good advice to actually call your midwife and make sure that you can be seen by a health professional who knows about breastfeeding, just to give you some more support. But what you might want to do is, or what you should be able to do is, if baby is unable to attach to the breast because we have this sort of flattening of the nipple, then we need you to soften around this area, the areola, before baby gets onto the breast. And the best way to do that is either with hand expressing or by using a pump if you've got one. And what you want to do is actually express the milk until it becomes much softer around here. You might even find the nipple starts to protrude a little bit more. And then as soon as you can, get the baby on to feed. Now if you're still feeling incredibly full back here, you might also want to express a little bit after you feed as well. And this can just help make you feel more comfortable and relieve some of the milk. Now the important thing to remember is that the more milk you take out, the more you can keep making it. And even in this very early stage, we don't want you to be incredibly full and engorged and uncomfortable. The other thing that you might want to try is something called reverse pressure softening. Now it sounds like a complicated name, but all it is with clean hands, you're going to take 3 fingers and push in and back on your breast, and you hold it for maybe 40 to 60 seconds. Then you're going to move your fingers around the breast, and what this is doing is pushing any fluid back into the breast itself and helping to soften around this areola so that the baby can attach and feed well. We have a full blog on dealing with engorgement and the best tips. You'll find some more advice in the blog, so please head over to there to read more about this, and we'll catch you another time.